Hi, I'm going to walk you through how to set up a PCA. So the first thing you're going to want to do is grab your tubing and your medication that you are going to be using per your provider's order. So the important thing to know about the tubing is that there is a Y port here with a backflow valve here. So your IV fluids are always going to want to be connected behind this backflow valve so that your medication doesn't backflow into your fluids. So you can use your medication to prime the tubing to the Y port. Once you get to the Y port, you're going to want to either take your fluids or a flush to flush the rest of the tubing to get rid of all of the air. Once you've gotten that done, now you can hook this up to your patient. So PCAs are always a dual verifier, so make sure you grab a friend. So when you grab your PCA pump, it always has to go to the right of the brain so that somebody can't accidentally take it off on this side, because the lock only controls to the left of the PCA or to the right of the brain. So it always has to be set up to the right. So when you have your PCA syringe, you want to slide it in. There's some dark gray hooks here that hold the syringe flanges. You want to make sure that one, you can see the volume, and two, that you can see the medication that is in it along with any kind of concentration. Very important. The other thing is you got to turn this gray switch to go down to hold the top of the syringe plunger. This mechanism here helps hold the PCA in its place, and it needs to be there for it to lock. So once you have this all set up, you can lock your door as long as you have verified with your other partner that they know what you have in here, right? To program the actual pump, you want to turn it to the program setting, and then you hit your channel select. Make sure that the current time is right, because that's important for when you're going to be clearing your settings later. I'm going to confirm. It's going to tell you right here to make sure that you've got all of the things in place, and we do, so we can hit confirm. Now, the PCA pump's kind of smart, and it will give you a couple of options. This is an actual syringe, so you're going to want to do the monoject, hit confirm. It's going to give you all your medication options. This is the part where it's really important to have your Epic pulled up as well, so you can look at what medication you've got in all of your settings. For this PCA, we're just going to do fentanyl. It's going to make you verify again your concentration is what is in the syringe. We're going to hit yes. Again, it's going to tell you here on the screen how often you have to monitor the person when you set up the PCA. That is also listed in the policy. So again, it's going to tell you your strength. You're going to hit next. This is where you need to pick what mode you want the PCA pump to go into. This is where you're going to review your order again with your co-signer to make sure that you hit the right thing. For this, we're just going to be doing a PCA dose only. It does give you options for continuous dose and continuous, or loading dose only. So now this is where it goes to your order. We're going to give 10 micrograms every 10 minutes with a max dose of 60 micrograms per hour. If there is a loading dose or your provider wants you to do a loading dose, this is where you would hit yes or no to a loading dose. We're going to hit confirm. You can actually lock the door, take the key out, hit start, and now your PCA is active. Once you've got all of your tubing primed and your PCA set up, now we're going to hook it up to the actual patient. So you should have IV fluids running. If you have all IV fluids running already, this is how you would do this. You're going to pause your fluids, and you're going to disconnect from your patient, and you're going to connect to the end of your short Y port. Now, if you're using your tubing to prime, this would be where you would turn your tubing on, or your fluids on again, and prime the rest of this. Since I already had it primed with my flush, I don't need to, but now that I have this all primed and ready to go, this is what gets connected to your IV site. So I would scrub the hub for 30 seconds as I discontinued that, and then I would hook this back up, and you can tape it down, and now it's all set up, ready to go. All right, I'm going to review too how to look at your settings. If you're taking over on the patient, you want to verify your settings are correct, or when you're doing your frequent assessments on how to clear your volumes. So you want to hit your channel select button here, and then it will automatically, even though it's still running, review what your concentration is, your intervals, and all of your settings. Now, to look at your volume to be infused, you hit options. And then here it says patient history. If you select your patient history, it's going to tell you that they had 1 attempt for 1 injection for a total of 10 micrograms. So it's really important to document all that, along with making sure that once you've documented that you hit clear. So you're gonna clear history. Are you sure you'd like to clear your history? Yes, I would. And you're gonna exit that and you're gonna hit start to make sure that the actual PCA restarts again.
When you get your orders to set up your PCA, you need to make sure that if you don't have an active IV fluid order running, that you ask the provider what they want for fluids running as well, and a rate, because you have to always have fluids running with your PCA at a KVO order or rate. So this here is now set up for the fentanyl PCA. So here you can see it's a dual verifier. The PCA does not integrate with Epic, so your rates will not flow over into the PCA like the IV pump does. So this is where it's really important to make sure you scan your med. Now that I have scanned my medication and it pulls it up, you can see here clearly what your dosing options are and what you need to be looking at for when you program your pump. So you'll still scan your medication, scan your patient, scan your medication, review this with another nurse or qualified individual, and then sign it off, making sure that you're documenting your RAS score appropriately. When you're doing your hourly frequent assessments and or the end of shift documentation, where you want to document your attempts and injections and amount is in flow sheets. So you need to go to your flow sheets and then go to I&O, and then once you scroll down here, you will be able to see, here's our fentanyl PCA, and you can put your action if this is where you're starting it, or just clearing it, or you're stopping it, or you're just verifying your rate and your dose. Here's your loading dose if you gave one, your attempts, your injections, and then the total amount that they had is down here.